I'm Dr. Raney. I'm the Medical Director of Access Health System in Durango, Colorado. I chair the American Psychiatric Association's work group on integrated care. Psychiatrists are going to need to learn the basic models of integration, and the spectrum of those models runs from treating mental illness in primary care settings to addressing the medical conditions in our patients with severe mental illness in public mental health settings. So understanding those models is going to be crucial to implementing the programs. There's some very specific aspects of these models that psychiatrists need to consider. The first is most of this care is population-based care. And what I mean by that is you're looking at the total health of a population, trying to discover specific mental illnesses that are there, even if a patient doesn't come in reporting those symptoms, and you use screening and you use tracking and other things to help you identify those patients. The focus shifts to the population as a whole rather than just the patients walking in the door to see you. There is as much concern about the patients that don't come back to see you as there is with the patients that actually do see you. So the shift is to the health of the entire population, both in the primary care setting where we're trying to identify mental illness, and also in the public mental health settings. We will be tracking and really looking for and trying to identify the health issues that are leading to the 25-year premature death. We learned how to treat diabetes, hypertension, and high cholesterol in medical school, but some of us are so far from that training we don't remember exactly how to do it, so it feels a bit daunting. But these are things that we need to retrain ourselves in, number one, so we can speak the language of primary care with our medical colleagues, but also some folks are looking at beginning to treat some of these chronic conditions themselves, and that's already going on in community mental health centers. So at the APA meetings in particular, we're beginning to offer some very specific courses to prepare psychiatrists for working in these integrated models as healthcare reform proceeds. One of those trainings is a primary care skills update course. We're doing that at each meeting now and have that scheduled both today at the IPS meeting but also in May at our annual meeting. We're really looking at focusing on common chronic medical conditions. That'll be the focus of our training.